Greetings and welcome to Across the Profession, a short interview forum series where we start to talk with nursing leaders and changemakers about issues related to diversity, equity, and inclusion. I'm Dr. Mitchell Wharton, a faculty member at the University of Rochester School of Nursing, where I also serve as the Associate Dean for Equity and Inclusion. Joining me today for our discussion on nursing perspectives of Hispanic Heritage Month is Dr. Michele Crespo-Fiero from New York University School of Nursing. Dr. Crespo-Fiero is a clinical associate professor at NYU's Rory Meyers College of Nursing, the director of NYU Meyers Lead Honors Program, and a fellow in the New York Academy of Medicine. Additionally, Dr. Crespo-Fiero is the president of the New York City chapter of the National Association of Hispanic Nurses. Welcome, Dr. Crespo-Fiero.
Oh, it is my pleasure to be here, Dr. Wharton.
Wonderful. Well, let's begin today, our talk today, talking about the history of Hispanic Heritage Month. Now, in terms of national recognition, Hispanic Heritage Month is a relatively young observance. So the month was intended to celebrate histories of cultures and contributions of American citizens whose ancestry came from Spain, Mexico, the Caribbean, Central and South America. And this observance started in 1968 as Hispanic Heritage Week under President Lyndon Johnson. A few years later in 1988, under President Reagan, it was converted to a 30-day period starting on September 15th and then extending up until October 15th. The day of September 15th is significant because of its anniversary of the independence of Latin American countries such as Costa Rica, El Salvador, Guatemala, Honduras, and Nicaragua. In addition, Mexico and Chile also celebrate their independence on September 16th and September 18th, respectively. Within this month-long period, there's also Dia de la Raza, or the Day of the Race, which honors traditions and cultures that were destroyed by European colonization. And this observance happens on October 12th. But above and beyond all of that, in addition to observing these historical events, why else is it important for us to recognize Hispanic Heritage Month?
Well, if you look at the history of Hispanics within the U.S. and within all of Latin America, I think it's very important to see that as an important part of U.S. history. And it's a very important part of the heritage as well. You have all the southwestern states, which at one point in time were part of Mexico before they were annexed after the Mexican-American War. And then you also have the state of Florida, which was also settled by the Spaniards. So if you look at that, I like to see it as Hispanic Heritage Month is part of one of the strands in the braid that is U.S. history. So it's important for all of us to know about it and to celebrate it.
It's so important what you mentioned there in terms of it being part of the braid. And so we often think of American culture as kind of this monolithic group, but we know that it's much more than that. Its origins have always been diverse, sometimes fraught with more struggles and more oppression than others, but it truly is a mixture, or I love that symbolism that you give of a braid and what that means. As we think about kind of the changing demographics of the U.S. and what it's looked like over the last 2 centuries, what changes or trends are we seeing with regard to our Hispanic population? And then we'll start to veer our conversation into the population of Hispanic nurses within this country.
Yes. So, the most recent data has been, analyzed now for the census that took place in 2020. And what we now have is, according to the more than 62 million people have identified themselves to be of Hispanic or Latinx heritage. And that represents 18.7% of the population. It's a 23% increase from 2010. But I think it's really important to recognize that this is most likely a severe or more severe undercount than has happened in the past. So, and part of that is due to the COVID pandemic, but also the effect of the citizenship question that was threatened to be added into that 2020 census. It was not added. It was not allowed very early on in the process. However, that message was not necessarily getting through because the administration at that time was continuing to try and have it added or try to collect that data in a different way. So we expect that many people who could have completed the census did not. And again, this didn't only impact Hispanic and the Latinx population. This impacted all of our populations of color. So, so I just wanted to kind of put that out there. But other things that we found out, or at least that we're starting to see, is that the majority of those, that 62 million, are US born, which is contrary to popular belief that most Hispanics living in the US are immigrants from someplace else. So that's another thing. We can also be of any race. So one of the other changes to the US Census is that it really expanded the opportunities to identify racially as well as ethnically. And what we now see is a decreasing number or percentage of Latinos identifying themselves as white and actually have an opportunity to represent their true identity, their true heritage. So for someone like myself, I had the opportunity to identify as multiracial, which is what I am. Previous versions, I was limited in my options. So we're seeing more of that coming up. Regarding nurses, we do have the 2020 National Nursing Workforce Survey results. Yes. And out of the 4.1 million nurses, and that being RNs, 5.6% identify as Hispanic Latinx, and 10% of the 39,000 LPNs identify as Hispanic Latinx. And I just want to make a note that the percentage of LPNs identifying as Hispanic Latinx increased by 2.6% from 2017, which was the last survey. However, for RNs, it was only 0.3%, which is disappointing, to say the least. Most other groups had more of an increase than Hispanic nurses. Now, in that data set, there isn't much other information that we can glean that's specific to Hispanic nurses. Everything else is separated out by race. So we can't say more about whether nurses are working in, whether or not they're APRNs or CNSs or working in other areas. But we do have information from the AACN survey that they do. They survey the schools every year to find out the percentages, the demographics of the students enrolled as well as their graduates. So for the last year that we have, which is 2019, for Hispanics, we have 13.2% are enrolled in bachelor's BS programs. 12.2% are in RN to BS programs. 9.8% are in master's programs. DNP is 7.1%, and research doctorates are 6.1%. And then for the graduates, we have in total bachelor's at 11.2%, master's 9.1%, DNP 6.7%, and research doctorate 6.3%. So the numbers are kind of stable. There really isn't much of a change, but they do not reflect both sets of numbers of RNs and LPNs and those enrolled in school and those graduating. They don't reflect the population of Hispanics in the US, and that continues to be a problem.
Yeah, and in addition to that, the numbers also don't reflect how Hispanic nurses are integrated within communities, as well as in terms of if we think about what is our pathway. I know we've traditionally used kind of the terminology of pipeline. I'm trying to get away from that. But in terms of pathways, as we think about nurses moving either higher in their degree preparation or moving more into academia and occupying spaces, so that there's an opportunity for nurses of Hispanic origin or Hispanic descent to actually be counted as a larger percentage of the educational workforce, right? And so as we think about that, I wonder if you have any thoughts in terms of how Hispanic nurses see themselves represented in the classrooms.
Oh, in the classrooms. I mean, I see that, and I think this is something that we see everywhere. In our clinical faculty, our adjunct faculty that are taking the students out to the clinical settings, I think we have a much better match. And students have more opportunities to see, faculty that look like them. But when we get to the classroom, that's not the case. We don't have as many nurses of color in general, Hispanic nurses that we're speaking about specifically right now. They're not there. And it is a conundrum that, we're all looking at. How do we encourage this, nurses to advance their education? How do, what is it that's perhaps, and I hate to use the word obstacle. I don't like obstacles. Where is the challenge, right? Where is the challenge for us to meet to address this? And I don't know that we're asking the right questions right now. But part of it also is that if we don't know who's who, right? With the numbers that we were citing previously, then we don't know who to go to ask the questions, to get the data, to then make the changes that are necessary.
Correct. I'd like to bring in another point of discussion here. So we're talking about race, we're talking about ethnicity. I'd like to bring up the topic of racism within nursing. And so earlier this year, the American Nurses Association produced a report on racism in nursing. And within that report, there's a specific section that talks not just about nurses of color, but specifically Hispanic and Latino nurses, in terms of their intersections of imperialism and racism and what that's meant for Hispanic and Latino nurses. I want to take this in two directions. So the first one, if you would care to make any comments about kind of that portion of what was talked about in terms of both the report and the racial reconciliation, but also thinking not just about a report. Let's think about individuals who are impacted and how this shows up still today beyond the imperialistic viewpoints and imperialistic standards that were imposed. What does this look like in terms of either microaggressions, macroaggressions, racism in the clinical environment today for Hispanic and Latino nurses?
And I mean, I think, it's a reflection of the history of colonialism, and the sense that being a person of color, being indigenous, being of African descent, is not desired, and that the European, the colonizer is, kind of held up to that standard up there. And that in some senses, there is very little that some of us can do to change, to appear more like that standard. And therefore, from the get-go, we're not meeting that standard. And then in other senses, there is, if someone could potentially, that we're called on to negate our heritage. We're called on to negate our traditions, our healing traditions. So that is a huge disconnect that in some cases for many people, as they're trying to get into the health professions, they're grappling with this identity crisis while they're trying to learn whatever the profession is. So I think that is a huge challenge for people of color that doesn't exist for others. When your history is negated, when you're in this carries, this actually comes from being in grade school, and when you're told, oh no, your people don't have a heritage, which is a message that has been communicated by educators for generations. So to then come into this profession that has been riddled with racism, and trying to meet these standards that are quite honestly not necessary to deliver good and safe quality care. So I think that it's a challenge. It's a real challenge. And I know that my experiences when I was in school, I mean, there was no one who looked like me, who had the same type of experience as me. Some of my peers did, but not the faculty at all. I don't know if it was something that I paid a lot of attention to back then. I think I want to be a nurse. I just focused on that. But I see it so much now. And to hear over and over when a student comes to me and says, I'm so glad you're here. I'm so glad that you said what you said. I'm so glad you shared your experience, that you spoke about something that has meaning to me. You spoke in Spanish in class. Those things really get to me because, it puts a lot of pressure, because then you're like, oh my goodness, you're on this pedestal and you're like, I have to live up to this now. But in another sense, it is just being present and being visible is so important to them, and it's so encouraging to them. So it's, that's kind of one of my, I would say my personal mission is to create more opportunities for visibility, to encourage all of the kids that are thinking about, I want to be a nurse, that they're like, okay, I can do it. So, and I feel like I may have strayed from the question. So you'll tell me if I did.
You are right on target. And there's something that you said in terms of visibility is key. And having people recognize you, or being a sense of being recognized by is such an important thing. So I know that you do a lot of mentoring and mentorship. I've been the benefit of some of that through the Association of Nurses and Aides Care. But it's when like kind of recognizes like, and it's like, oh my gosh, I'm so glad that you're here. Oh my gosh, yes. I've never seen anyone like you in this position or doing what you do. Is such a valuable thing. Yeah. And because we're talking about Hispanic Heritage Month, I think that I may have gotten us on a path of kind of, racism and whatnot, but I'd like to bring it back to what this is really supposed to be, and that is a celebration. And so as we think about our profession, what have been some of the more noteworthy contributions of Hispanic and Latino nurses? Who are the change makers? Who are the people that we may not hear about on a regular basis, but we probably should have some recognition of.
Yeah. So, I mean, and I think, again, that whole idea of visibility, sharing our stories, telling our stories, that's how we create that, that record of our history. And this is something that definitely needs a lot more work. But, you cannot talk about Hispanic Heritage Month without, and nursing, without mentioning Dr. Hildaura Murillo-Rode, who was the founder of NON, and she actually has some other notability. She was the first PhD out of NYU, Meyers, and she held deanship in at one of the SUNY schools, and so she's an important person. There's also, I think of Miriam Mimi Gonzalez, who actually worked with Dr. Murillo-Rode, but she continues to be a fierce advocate of Hispanic nurses. And I am so honored to be mentored by her. And she's just wonderful. And anybody in the downstate New York area knows Mimi Gonzalez. I think of someone like Sylvia Mendez. And she's an RN. She thankfully is still with us, but her family, she and her siblings were represented in the Mendez versus Westminster court case. And this was out of the Orange County in California in 1946, where they integrated the school system there. They were, and that was actually the case that Thurgood Marshall used in 1954 to argue for Brown versus Board of Education. So because her family was able to get her into the school that was quite honestly right across the street from where they lived, an integrated school, she got the education she needed to then go on to nursing school. So I think that is something that's notable. She also received the 2011 Medal of Freedom from Presidential Medal of Freedom from Barack Obama. You think of someone like Tony Villarruel at UPenn. You think of Maria Shirey, who is out at UAB. Those deans of nursing schools. Those are important change makers. And I'm only naming two. There are quite a few others. I don't want to miss anyone. But then I also think of someone like Polly Joseph, who is the inaugural American Academy of Nursing Fellow at the National Academy of Medicine. And that's just a brand new title as of this summer, and position as of this summer. So, I mean, there are lots of nurses out there, but there are also the nurse educators who made that transition from practice to clinical, being clinical instructors, to actually being in the classroom. They are change makers. And then the students that are up and coming, they're going to blow us out of the water. What they're going to do is just going to be amazing. So when we have many more gray hairs, you and I, and we'll sit in our rockers, sipping a little coffee or something, we can talk about all of these wonderful students that are going to come up and help us make all the changes that need to happen.
And that's the beauty of it, is to know that legacy doesn't end with these historical figures or these inaugural figures, but it's ongoing, and it will continue to go, and they continue to grow, and people will continue to flourish. And that's, for me, that's the most beautiful part of kind of what I do in seeing students or seeing nurses in clinic and in other areas of the profession as they grow, as they continue to move, as they continue to motivate, to mentor, to do all these wonderful things. This is excellent.
Yeah. Oh, can I just mention, if you want to know more about nurses and actually all nurses of color, you can put in your search engine, nurses you should know. And this is a website that updates regularly and includes profiles of all nurses of color. So if you're interested in learning about African-American nurses, you can get that. Asian and Pacific Islander nurses, Native Indigenous nurses, Hispanic nurses, they're all in there. And they're also accepting new submissions as well. So
that's excellent. That's excellent. So I would encourage all of our viewers to definitely review the site and consider putting your name forth as well. Earlier you mentioned NAN, and I wonder if you could talk a little bit more about the National Association of Hispanic Nurses.
Sure. So, NAN was founded in 1975, and it came out of a recognition. There was an ANA meeting that was happening, and I guess I'll spell out that initial that acronym: Association of Nurses. Oh my goodness, American Association of Nurses. You know what I was gonna say. Anyway, so they were at this meeting, and there was not representation. They felt that they were being ignored, and they had tried at previous meetings to get some of their concerns recognized. And, you know, they were being ignored. So what they did, as the story goes, they went into someone's hotel room and they all just started talking amongst themselves and decided they needed to start their own organization. And that's where that came from. So the mission of NAN is to, they're committed to advancing the health of Hispanic communities, to lead, promote, and advocate the educational, professional, and leadership opportunities of Hispanic nurses. And they've been doing this, again, since 1975. Their website is nahnet.org. And as you can see, sorry, wrong side. You can see over there. You know, they are a really great opportunity for networking, for educational opportunities, leadership development, scholarship, service, all of those which are important, again, for the development of the individual nurse, but also in giving back to our communities, which is something that we're all very focused on. You know, NAN is I would like to say that there are other organizations out there as well that that seek to provide these types of opportunities for Hispanic nurses. NAN has been around the longest, but you know, everyone needs to find the place and the space that makes the most sense for them.
Absolutely. So as you were talking about NAN and part of their mission, I can't help but to recognize that there's some overlap in terms of what NAN is doing and what the Future of Nursing report talks about in terms of health equity. So I'm wondering if you can talk a little bit about what the nursing landscape has been looking like, particularly from Hispanic nurses' perspective, or actually, let me scratch that. I wonder if you could talk a little bit about what health equity has looked like from a Hispanic and Latino perspective, and what types of advancements have actually been achieved, and what kind of still needs to be done with respect to both the larger Hispanic and Latino population, as well as Hispanic and Latino nurses.
Okay. So, you know, as you know, when we talk about disparities and inequities, you know, we can talk about the access issues. So we can talk about the fact that Hispanics may be less likely to carry insurance, whether because of their immigration status or because of the types of jobs that they hold. There are communication challenges. If the provider does not speak Spanish, or, recognizing that we have communities that would primarily speak indigenous languages as well. So not having someone to communicate with in the healthcare system. We also know that if legal status is an issue for someone, that's going to be a concern about whether or not they will engage with the healthcare system. There will be concerns about being reported, and we do have instances where people have sought care and then were reported to Immigration and Nationalization, INS, by nurses in some of those instances. And then the jobs that many people have, the schedules. So if a provider or a clinic is open during regular business hours and someone works a 12-hour shift, someone has to be ready to be able to be picked up for their job at 7 in the morning and they don't get back till 8 o'clock at night. They're going to miss those times that the clinic is open. So I think one of the biggest concerns that we have is just being able to get into care. Mm-hmm. And then when we look at other concerns having to do with exercise and diet, access to healthy foods, access to some of their traditional foods, not the versions, that what tends to happen here is that there is more easy availability to the types of food that you eat for the holidays and to celebrate, which tend to be, higher in fat, higher in calories, as opposed to the more traditional foods that people may eat on a daily basis, which tends to be healthier. There is something called the Hispanic paradox, which discusses, or at least it attempts to tease out this phenomenon where when people come to the US, they tend to be healthier than after they've lived here for a while. And part of that is they're assuming more of the American diet and the American exercise patterns, being more sedentary versus more physical. We have public transportation and cars, which is great, but we don't walk then. We don't walk as much, right? So we don't get as much exercise. So that's another thing. So we tend to see, as far as specific conditions, diabetes. There's a greater risk for diabetes that we see. And then, of course, as you know, with diabetes, we're going to have the risks that go with it, with heart disease. And then there are some types of cancer that we may see more commonly. And some of them are more connected to, again, that inability to access care and in an earlier time frame. Earlier on, and also in the primary care setting. That's where they don't, again, if they don't have insurance or they're unable to access their provider because of their work schedule, they're more likely to be seen later on in a disease process, and also be seen through the emergency department, which has that could be a whole nother discussion on another day on what that represents. So and all of these stem from the experience of structural racism in our country, oppression in our country, and again, kind of hearkening back to when we were talking about those statistics. if we're not if we can't get access to people, then we can't document what's going on. We're not generating those numbers. We're not collecting those stories that they have for us to better understand what's going on and then address those problems. We can't have those, we can't identify what resources they need and make them available to them. So it's tough. It's very tough.
It is, but I think it's worth reiterating that what we're seeing, particularly in terms of problems or issues and or challenges, are systemic issues. They are policy issues. They are not individual group issues. It is how individuals either find their access or entry point into a system, and then how do you survive within that system? The system is already created. The system that has its own rules, has its own mechanisms, has its own momentum. It is truly not designed to incorporate new ideas or other ways of being. And when we think about some of the challenges and the issues that are here, and when they're talked about, they're often talked about as this group has a problem.
Yes.
I just want to reiterate, it's not that the group has a problem. These are systemic issues, and the system is what is causing much harm to these groups of people, to several groups of folks. But today we're talking about Hispanic individuals within the U.S.
Yeah, and it's and I think also, pointing out that it is policy. It puts the onus where it needs to be, because I believe that in the healthcare system itself, and then more specifically, individual providers, nurses, physicians, nurse practitioners, the belief is that having access to that individual is going to be enough to make that difference and that change, and it's not. It's important that people have a provider that can speak their language. It's important that they have providers and nurses who understand their culture. And a lot of times it is understood by some, it's a very simplistic understanding, that the sole reason to increase our numbers in the health professions is to address these disparities, and that's all that's needed to address those disparities. And that's not the case. It is only going to get us more information. Yes, it'll help some individuals, but it's not going to make the policy changes happen that are necessary to help our populations. And that's what's going to really improve, the experiences of health in this country. So, it's good that we do that, but, the individual nurse can deliver culturally congruent care, also known as patient-centered care. But then we set up this situation where we're expecting that 5.6% of those nurses to take care of 18.7% of the population. And that's too much. But having nurses who are of Hispanic heritage on the units also helps other nurses to learn how to take care of those patients, can help them to learn, just some basic phrasing in Spanish to, ask, ¿dónde está el dolor? ¿Cuánto, cómo se siente? Those simple phrases and the kind of expected responses can help build that trust that's necessary to, again, one piece of that puzzle to health equity, to reducing those disparities that we see. One piece.
And also inspiring a new generation of nurses.
Yes, absolutely.
This is wonderful. I have two last questions for you, if that's okay.
Sure.
So I would be remiss if we didn't talk about your role as president of the New York City chapter of the National Association of Hispanic Nurses. So is there anything that you'd like to share about the New York City chapter or your priorities or the work that's being done there?
So it's been, I'm coming to the end of my presidency. It's been almost 3 years. And unfortunately, the pandemic kind of derailed a lot of what I had anticipated doing. But my goal, and it still remains that, is to really increase that visibility, not just of students, but also of faculty, because I feel that there are many faculty people who are of Hispanic heritage, who we may not know of, because maybe they don't have the typical look. They don't have the typical name. And sometimes they also may come from experiences where speaking up about their identity was a problem for them. So they've kind of learned to stay quiet. The other things that I'm looking to do is to make those connections so that way people can want to be a part of any professional nursing association. You know, we have a lot of responsibilities to family, and that sometimes gets, I don't want to say gets in the way, but is the priority. And it becomes hard to see how other parts of what we do and can do can fit into our day, our week, you know, our year. And sometimes it's just getting that foot in the door, because there's so many opportunities to be replenished when we meet. You know, that opportunity to share, the opportunity to say, you know, I had this happen to me, and someone say, yeah, I know what that's like. I've been there, you know, share those words of wisdom. It's just, it nourishes you and keeps you going. So that's been kind of where I've been focused on. And I'm blessed that I am remaining on the board and my immediate past president role. So I will get to do a little more work with our schools of nursing and being able to connect more faculty with our chapter, and then also more students. You know, I think one of my favorite memories is when I would go, when I wasn't in leadership with Non-New York, and I would come and I would bring students with me, and they'd be like, oh, there's Michele bringing her students. But it was great because it was that you're here. You're here, and we're glad you're here. So creating that space was really important, and holding that space for our nurses during the pandemic was so important. And, you know, it's like, you know, thank you for these virtual platforms that have helped us to do that. But, you know, expanding that circle has been, you know, something that I've been committed to, and I'm still going to work on it.
Excellent.
Yeah.
Well, that's one of the goals of this short form program or short form interview program across the profession, is really helping to connect people and to give them a sense of what else is out there. Sometimes you become so siloed in our individual areas or because of geography that we recognize that we may be struggling with something, or we may need some additional bolstering or support, but don't know where to go. So I do want to thank you for being here today and offering that to our viewers today. Hopefully we'll have some more people kind of becoming more engaged with the National Association of Hispanic Nurses, either at the national level or throughout the state, and hopefully you'll hear some more inquiries in your chapter. But before we end our discussion today, I just want to, I think it's important to remind our audience that although we're discussing celebrations of Hispanic heritage and communities and patients and our peers, we must also be mindful of the fact that we have intersectional identities. And so that they shape how we travel, how we experience education, how we experience health, and how we experience community, just as you put so eloquently. I wonder if you have any closing thoughts before we end today.
So, when you talk about intersectionality, I see that as Hispanic identity, that we are intersectional because we have, our heritage, which is indigenous, which is African, which is Asian, which is European. So we have all of those together. And we can think of it in the more traditional definition that some people consider. But I see it as we have to remember that we are more than just the boxes that we check. And onto that, I'm going to add the boxes that we are given to be able to check, right? There's many times where other, and then there's no space to fill in what that other means to you. But we all are intersectional, and all of those come together in different ways for each person. So to kind of, stay away from this idea that everyone is the same or everyone is only one thing. We are so many different identities, all at the same time. It may be that while we're communicating, I'm only inhabiting one of those identities in that moment. But that's not all of who I am. It's not all of who you are. And to just be reminded of that, and, to keep that in mind, that there's always a part of the stolen story that we don't know. And that if we allow ourselves the opportunity to learn about it, how much better would we know that person? How much more could we do with that person to achieve the outcomes that we all want?
I couldn't have said it better. Thank you so much for joining me today. I greatly appreciate your time and your wisdom, and we'll share some of the links that you've mentioned earlier.
Yeah, it is has been my pleasure to have this conversation with you. And I know that we'll have more conversations like this in the future.
Absolutely.